a common sense approach to the prevention and control of respiratory viral infection and coronavirus. I am answering a call from our President and the Vice President to help control the new scourge that is affecting our society now. I am not an infectious disease expert, but my extended education about virology and pre-med, proper medicine, and care of patients with respiratory infections may help control this scourge. After listening to all the news and experts' advice, I think the public should additionally be educated about the details of how the virus spreads in the body and cut off their spread in the initial stages of the infection in common language. This is how the respiratory viruses looks like. These are their hands and feet, the capsid envelope or the cover, and that's the genetic material. First, they attach themselves on the host cell, which is the body cell, and dig its way in, and once they reach the nucleus of the body cell, all the genetic material will pour in or attack in, and they control this cell, and this cell starts producing new viruses, and these new viruses will start attacking other healthy cells. And this is how the nose looks like. These are the turbinates, the sinus in the back of the nose, the side of the nose, and the front of the nose. The initial body response would be sneezing, runny nose, nasal congestion, and localized soreness. The virus may also use the mucus as a vehicle of their spread locally. This is the critical time that I would suggest to cut off their initial localized spread before they enter the larynx and the lower airways. At this point, it's up to the body's defenses to fight them off. This recommendation is in addition to what the experts have already suggested. How can we control and prevent their spread locally? Number one, by washing our nose, sinuses, mouth, and eyes with the use of warm tap water. Respiratory viruses are sensitive to heat, and that is how our body responds by increasing the temperature as they enter the blood and other body systems. Tap water may still have traces of chlorine and non-disinfectant. Number two, study the anatomy of the nose, sinuses, pharynx, mouth, and eyes to adequately wash the whole area. The maxillary sinuses are draining upwards into the nose, so it is necessary to bend your body and head downward towards the sink to wash everything completely. Wash and blow your nose and sinuses until no mucus comes out. First, you have to wash your hands with soap and warm water, and then wash your face and start putting water into your nose and inhaling it and blow it repeatedly and more of it and blow it repeatedly until no mucus comes out. Do this common sense procedure about 3 times a day, morning, afternoon, and at bedtime, or after going to gatherings or public places. Finally, I wish everybody well. Even though we thought our society has advanced rapidly in the past century, there are still others who oversee our progress and place us back towards our destiny when we go astray. May God bless you all. Thank you.